We are recording and you're free to start anytime.
All right. Good afternoon, everyone. My name is Doreen Garland, and I, along with Councilmember Joel Navarro, would like to welcome you to our Human Services and Community Safety meeting. I'd like to call this meeting to order. It's important to understand that no formal votes or decisions about city programs, policies, or budgets will happen here. Our role is to explore various topics with staff and stakeholders and community members, and to make recommendations to our council colleagues. We want this process to be transparent, inclusive, and easy for you to be a part of whenever you choose to be. And you can share your thoughts with us by filling out a comment card about any item on the meeting agenda, or by reaching out to us directly with any other thoughts, questions, or ideas. We need you to fill out a comment card in advance that can be read into the record for any agendized item. The link to the comment cards can be found on our committee page at the Tempe website. It's tempe.gov/HSCS. And you will also find on that page contact information for committee members and staff. So I will go to item number 2, review meeting minutes. Councilmember Joel Navarro.
Hey, Councilmember, you muted.
Got it. Tim, the meeting minutes I have from the last meeting.
You can motion to approve.
Yeah, I was saying, I'm trying to think if there was categories. Yeah, just a motion to approve meeting minutes from meeting set. I believe the date was February 26, 2021. Yep. Motion to approve.
And I second. Wow, that was easy.
Yeah, just me and you, huh?
That was super easy. All right, number 3 on our agenda is public comments. The next, that is this committee welcomes public comments. According to the Arizona Open Meeting Law, the committee may only discuss matters listed on the agenda. Matters brought up by the public under public comment that are not listed on the agenda and cannot be discussed by this committee. A 3-minute limit per person will be in effect. Tim, do we have any comment cards for this meeting?
Councilmember, not that I've seen.
All right, I appreciate that. Thank you, Tim. So we're just going to go ahead and move on to item number 4 on our agenda, the committee session items. And our first item that we have for us to discuss is a regional approach to homeless solutions. And many times you've heard our council talk about homeless issues on our council meetings. And we always discuss at the same time that it's a regional issue. It's not an issue that we deal with just directly and only in the city of Tempe. So I'm happy to introduce Amy St. Peter, who is the Deputy Executive Director of MAG, which is the Maricopa Association of Governments, and she is going to talk to us about a regional approach to homeless solutions. Amy, welcome, and thank you so much for being here.
Thank you very much, Madam Chair, members of the council. It's my pleasure to have this time with you today. I do have a presentation which was sharing just fine just before we started the meeting. Let me try that again. And okay, are you all able to see my screen now?
Yes.
Excellent. Thank you so much. So I am excited to be with you today. Thank you very much for this opportunity. The Maricopa Association of Governments has been staffing the regional continuum of care since 1999, but back in October, we started really strengthening and ramping up our regional response. So we fully agree with you. The best response to homelessness is a regional one that's fully supportive of local efforts, as well as relevant to those local efforts. So my goal in sharing this information with you today is, one, to bring you up to speed on these regional efforts, to be able to share with you the latest information, to be able to hear your priorities, your concerns, your needs, and that's in an effort so that we can best meet those needs and to help you to achieve your priorities, and then really to fully engage you in this work moving forward. I encourage you at any time, please, to stop and ask me questions. I really see this as a dialogue and look forward to your feedback. I do in particular want to thank Naomi and Nikki. They've been fantastic to work with. They've been doing great work within the city of Tempe, supported by you as the elected officials, and they've been a great support to these regional efforts as well. So we thank Naomi, we thank Nikki for their really consistently superior service in this space. So moving along then, my screen does not seem to be advancing. Are you able to hear me still? Hello?
Yes, we can.
Okay, great, thank you. Well, I'm not able to forward my screen. Let me see. Okay, oh, there we go. Okay, moving right along. This is our focus and all of these regional efforts, and we hope that these resonate with you at the community level as well. Through all of these efforts, we're very focused on creating a regional system that honors and lifts up those local efforts. And so in doing so, we very much want to reduce the numbers of people who are experiencing homelessness. We want to increase access to homeless assistance programs throughout the entire region. Every community can have a role and a very impactful one in this work. And then particularly to strengthen the safety net for all people, keeping in mind the impending wave of people who may become homeless, many for the first time, when the moratorium is lifted on eviction. So we very much want to make sure that we're strengthening that safety net and we're positioning ourselves to be able to stably house people moving into the future. These are just some of our partners. We absolutely consider this, the City of Tempe to be a very strong partner in this space, working very closely with the Maricopa Regional Continuum of Care and leaning on their expertise. We're also working very intensively with a newer group called the Regional Collaborative on Homelessness. This is a partnership among 6 different regional entities who are all addressing homelessness and who are all doing so at that regional level. So this includes not just MAG, also Maricopa County, the Arizona Housing Coalition, ASU's Action Nexus, and the Vilas Health Foundation and Valley of the Sun United Way. So we're working very closely with them and working very cooperatively. And so as we invest our own time and efforts in this space, we're able to achieve more benefit because all of us are able to use this information and use it for not just in these collaborative efforts, but also in our individual spheres of influence. Partnering very closely with the cities, towns, counties, and Native nations. Again, as we develop a portfolio of regional strategies, we understand that there might be a number of different partners and activities, but all of these need to be implemented in communities. So it's vitally important to be able to work with you as these strategies are being developed and to really work with you very, very closely as these strategies are being implemented in your communities. Of course, MAG is very heavily engaged in this along with a number of other stakeholders in a number of different sectors. This is a brief timeline for this work right now. It started, as I said, back in October, but really intensively started with initial rounds of research and outreach that are continuing and just wrapping up this month. As we're moving forward with those regional strategies, we do have a prioritized list now that is being reviewed. Particularly, the first step for that will be at the Municipal Staff Forum next Tuesday, March 30th, and continuing on then with an elected official forum on April 14th. We hope to see all of you there. When the portfolio is offered for action in May, we do hope that it will be approved. Upon doing so, we will pivot very quickly then to implementation. We'll follow through with developing a tactical plan to implement these strategies from June and then presenting that for approval come August. This is the process that we've used. I do want to highlight that all of this work is embedded in your local strategies, your local priorities. We created an inventory of those local plans, strategies, and action steps, more than 300. We then started to funnel that through a very careful and thoughtful strategic planning process. So we wanted to draw on not just the best of what's happening here locally, but we wanted to look for those really effective practices nationally. We're able to identify those strategies and then able to identify about 40 or so different regional strategies for consideration, further filtering those among 5 different regional goals, and then come May, be able to present that final regional portfolio through the Maricopa Regional Continuum of Care, the MAG Management Committee, which includes your city manager, and the MAG Regional Council, which includes your mayor. All of these efforts then are really supported by the research, outreach, and coordination as we move through this process. This is a sampling of just some of the work that's been completed. Again, really leaning very heavily on that national research, the local inventory. We have had funding as a key item of concern and opportunity from the very beginning of this work. We understand that we need more funding, particularly from a multi-sector approach, public as well as private investments, in order to be able to successfully implement these strategies. Outreach has been critical. We've had public forums, we've had one-on-one interviews, all have been very candid, very constructive. One piece of analysis that we've just recently released is our surveys of law enforcement and first responders. These are two critical groups, and while homelessness might not be their primary role, their primary function, often they're the first point of contact for people who are experiencing homelessness out in the field. And in doing so, they have a unique and valuable role. We've just completed a survey. We thank you very much for your support in promoting that survey and completing that survey. We're using the results and the analysis then to fine-tune these regional strategies, as well as inform our ongoing work, partnering very closely with both law enforcement and first responders. This is just some of the work that's currently underway. As mentioned, really working hard to validate the prioritization that's been applied to the strategies, making any changes as needed, and then deepening and adding detail to those strategies. We are just about on the cusp of completing a study on siting considerations. We understand that as new communities engage in this work, they will be in perhaps a challenging position of cultivating community support. And so we very much want to give communities the tools that they will need in order to be able to launch these new homeless assistance programs very successfully. We are working very closely with communities like the City of Tempe, understand the investments that you're currently making to address homelessness. The City of Tempe has really been a leader in this space. We want to understand the investments that you're making so we can better understand the fundraising that will be needed in order to implement these strategies. We want to be able to make all of this data available to you on an ongoing basis. And in doing so, we've created an interactive map that illustrates not just the assets used to address homelessness, such as housing, shelter, and services, but also the demand. So where are the populations who are experiencing homelessness right now? Where are those people who may be at risk for becoming homeless in the very near future? And of course, the outreach forum series is underway, where we'll be meeting with the municipal staff next Tuesday, and then the elected officials such as yourselves on April 14th. This is a progress to date. We've actually increased these numbers just since I've developed the PowerPoint. We've touched more than 1,000 people then to be able to inform these efforts from very diverse sectors such as the nonprofit community, housing leaders, the faith community, business leaders, and philanthropy. We've been looking at the municipal budgets very closely with you, again, to understand your investments. And we do have those two studies underway right now, looking at the siting considerations, as well as looking at the expenditures made to date, all driving towards the development of that regional portfolio. This is the map that I referenced earlier. This is available right now in a beta version for review. And we are looking to add additional functionality and data to this map, such as those population concentrations of people experiencing or at risk of becoming homeless, as well as additional functionality like being able to print the maps and run reports at your specified geography. These are the next steps. As we move forward with this work, we will continue the outreach series, and we'll continue to analyze all of the research findings, the survey results, as we fine-tune that draft portfolio for action then in May. This is my direct contact information. It's a pleasure to be with you today. I hope to continue this conversation with you to hear deeply your priorities, your concerns, so that we may best respond to those needs, exceed your expectations, and help all communities throughout the region achieve their opportunities then to strengthen that regional infrastructure to address homelessness. That does complete my presentation now. I'll stop sharing and come back to all of you, and would love to answer any questions, hear any feedback that you might have.
Okay, thank you very much. That was a wonderful presentation, and I do have a couple questions. So when you were doing the survey that you had talked about, your initial research, is this survey, you said, of business partners, of other organizations? Is any part of that survey actually talking to homeless on the street or in homeless groups?
Excellent point. Thank you so much for that. We do have two different avenues for that. One is a survey specifically for persons with lived experience. And so those are people who have been or who are currently homeless right now. We are working with a variety of different, particularly nonprofit partners, as well as the local governments, to make sure that this survey is broadly shared throughout the entire region and that we are receiving those results back. Those surveys are due back to us by April 7th. And at that point, then we'll be able to analyze the findings from that survey and really be able to embed the preferences, the experiences, the insights of people with lived experiences, and as some put it, lived expertise in homelessness.
Okay, because we have a group here that the mayor and I attended a meeting a few months ago where an organization called the Eris Foundation, and I went through and I looked on your map, and it was very easy to use, actually.
Oh, good.
So I did go on there and I found their organization. It's called the Eris Foundation, and they do a feeding in Tempe, and they also take care of pets there. But she pulled together a group of people with lived experience, and we're calling it, she titled it the Homeless Forum, or Family Forum. She's changing the names, but we actually sat down with about 12 people who had lived experience and listening to them and their perspective on the services that we think are really great. And they're saying, well, that's great for you guys, but it doesn't quite work for us. So it was really helpful to be able to listen to them. So where can we get the survey if we wanted to? She meets with them, this group, every Tuesday. It'd be great to be able to hand out surveys to them every Tuesday, or just ask them if they can find a way to get on and fill that out for you.
Thank you very much. We very much do appreciate that. I would be happy to send you this survey. I can also send that to him, and I believe that Naomi has a copy of that as well. So
Okay,
however we
great.
can best get that to you, we're absolutely happy to do. And if there's an opportunity for us to come and speak with the group as well, with the Homeless Forum, that would be fantastic. We very much want to authentically bring the voices of people who are experiencing homelessness into this work. We're also drawing very heavily from a racial equity plan, which Nikki from your staff actually helped to spearhead. And as part of that process and developing that racial equity plan, we're able to speak with people and gather feedback from people who are experiencing homelessness, and then able to have their voices reflected in the action steps, which have been embedded in this regional portfolio of strategies.
That's wonderful. Thank you so much. Joel, do you have any questions?
No, a couple. I guess and thank you, Doreen, for bringing that up about reaching with the homeless people, getting their interactions and survey them. That's vitally important. Obviously, my experience working in downtown Phoenix with CAST, that's exactly, the conversations we would often have, just to kind of, hey, what's working, what's not working, what do you really need, what would really help, type of thing. And you really get a real good gauge of things that are being missed, possibly. So I think that's going to be great. If they do, or if there are people that would like to take part of that survey, are you going to provide a paper copy, or is it a digital copy, or digital platform that they're going to be able to use? I don't know if that's either one's going to be helpful or not, but I would imagine a digital one if they had laptop or just iPads or something like that going forward. The second question is, with the survey and everything that your findings, I suspect, and I think you kind of mentioned it, that there will be some projected outcomes, best solutions, goals that we're going to try to achieve once those surveys and information is collected. And April 14th is when we're going to share that information. And then are we then talking about what would be potential outcomes or potential goals and outcomes?
Absolutely. Thank you very much. To go back through the comments and to respond to your questions, and thank you for all of those. Do you want to point out too that if you go to the MAG website, azmag.gov, if you click on programs and then homelessness, there is, and then regional strategies. So azmag.gov, click on programs and then homelessness, you'll see a landing page then for this regional strategy work, and all of the documents that we've been able to finalize so far are available on that website, including the survey, actually. We're also happy to run out hard copy versions of the survey to anyone who might need those, and we're happy to email that electronic file as well. So thank you very much for that. In terms of the strategies, and we are posting the emerging strategies as well in terms of what has been set as a priority set of action steps for the region so far, needing to validate these, to vet these, to refine these and deepen these as well. Those will also be available on the website. Hopefully today, if not today, then definitely by Monday. And we have also sent them out to the intergovernmental staff from each of the cities, towns, and counties, as well as the human services directors. And we're happy to share that with anyone in addition to those groups. So really with the municipal forum next Tuesday, that's really the first opportunity then in more of a public setting to be able to get feedback on, are these the right strategies? And actually to have all of the people attending the forum be able to rank those and say, this is my highest this is my highest step right now that I need to take as a region, as an individual city or town or county. So that will be the first step. And then with the elected official forum, absolutely, that's a very important next step then to be able to make any refinements to those strategies based on the input from the municipal staff forum, and then be able to prepare that for you. As we deepen these strategies, we will get very specific around, this is what we anticipate these strategies will cost. This is the intended impact. This is the projected number of people served, and we'll be able to convey that to you. And then as a portfolio is going forward for approval, you'll have a good understanding of not just what we're doing, but what kind of impact will it have? And then as we develop the implementation plan, we'll also have a very good idea of where will these strategies be implemented, really looking to the cities, towns, counties, Native nations to provide the leadership to say, we will take this on. We will form a shelter here. We will provide more housing there. We will make these services available here. The where in this question is critically important, particularly as we're very committed to geographically dispersing the homeless assistance programs. And that's a bit of a shift. For a while, the focus was on centralizing services, and that's a very worthy effort. Now we're finding additional value then in dispersing these homeless assistance programs. So for example, how can we create a regional system of local shelters? Because people stabilize more quickly when they stay in their home communities, whether they're housed or not, it's still their home community. And for local governments, it can be more relevant for you, more effective for you to spend your community dollars on your community residents. And so that's part of the reason then for dispersing these programs and making sure that we can demonstrate that impact throughout the entire region as well as at that community level.
Got it. So those goals will be defined
Yes.
as you get through. Good.
Yes, right now the strategies are very high level. We want to be able to add depth to the strategies that are prioritized most by our communities, and that's where we'll lean in with our efforts.
Gotcha. Thank you.
So will the information that you have be have demographic and geographic information specific?
As we add more depth to it, yes. Right now, we don't have that level of detail available, particularly keeping in mind that the portfolio will be going forward for approval in May, the implementation plan in August, and then in the fall, launching a very comprehensive effort then to actually develop a more robust regional plan to end homelessness that will be much more detailed about the subpopulations and I think the demographics that you're looking for. At any time, though, we're happy to run the data analysis for any community. If you're interested in finding out with more granular detail who is at risk for becoming homeless in your community, what are the demographics of people in your community right now, and we're happy to fulfill those data requests as we receive them. So there's a couple of different opportunities then to be able to get more detail as wanted.
Okay, and then what can the city or what can this committee do to help move this forward so that we get that information, understanding that needs in different cities are different. Homelessness in Tempe, the unsheltered in Tempe may be different than the unsheltered in Phoenix, and the needs and things are different. What can we do as a committee and as a city to help move this forward?
Thank you very much. The city and all of you have been doing a lot already, and we very much appreciate all of your support. Moving forward, it helps particularly to get your help on the front end as well as the back end. So to be able to hear now what your priorities are very clearly, to hear what you want to see in those strategies, what you don't want to see as a strategy as well is also very helpful to hear. And then as we start to really fine tune and get that regional portfolio ready for action then in May, to make sure that it resonates with you, to make sure that it meets your priorities, and then to stand to be able to stand with you then as a full partner as we seek to implement these strategies. Tempe is making significant investments. You're already very much a leader in addressing this issue, and we hope to be able to build on that and then to offer that throughout the region as an example of how to really closely partner together and to have impact. Everyone right now is very much focused on action and being able to achieve something together. And so we really stand poised at this unique moment in time where on one hand, we're faced with this incredible crisis that's tragic on so many levels, but on the other hand, we have so much support for these efforts right now. And so being able to work with you to implement these strategies will really be critical.
So what's the end goal? What's the end goal after all of this information is gathered, after, at the end in the presentation, I think you said April 14th or something when the president presenting to the electeds, but what's the goal once we get all this information? What are we going to do?
Absolutely. We have strategies in 5 different areas, and that includes housing, shelter, services, diversion and prevention, and coordination. And so right now we are offering 14 different strategies throughout each of those 5 different areas, and they have concrete action steps. And so those action steps are things like building up that regional network of local shelters. So can we site more local shelters in additional communities, particularly in the outlying areas? And there are some communities right now that have heavy concentrations of shelters. There are some that may not have any shelters. And so we want to make sure that people who are experiencing homelessness can receive assistance no matter what community they're in the region. And what that assistance looks like, how those services and programs manifest will be different in each community. So we want to coordinate activity at that regional level to have impact at that local level. It's critically important for us to be able to support communities in whatever strategy and whatever approach makes the most sense for them and resonates the best with them. So say if we're looking at this point in time, but a year later, we'll see more homeless assistance programs available throughout the entire region. And we'll see the numbers of people who are experiencing homelessness decreasing significantly. And we'll see more people who might have experienced homelessness before be diverted into more sustainable, more cost-effective, more humane measures and forms of assistance.
Okay, well, I appreciate that. Thank you. Joel, do you have any other questions?
No, I think that was great. I do appreciate your presentation, Amy. I think it was great, wonderful. A lot of work, obviously, going on the subject matter. So I know I'm part of the group over there and just kind of hearing some stuff. So yeah, look forward to hearing some more information.
Excellent. Thank you very much. Really appreciate this opportunity. And please do feel free to reach out at any time. We appreciate your partnership on this critical issue.
Wonderful. Thank you for joining us.
Thank you.
All right, so we will, after that presentation, go ahead and move on to our next presentation, which is going to be from Rosa Inchowski, our Director of Strategic Management and Diversity, and we will be discussing the COVID-19 wastewater dashboard update. Rosa?
Yes.
Thank you.
Thank you. Good afternoon, Councilmember Garland and Councilmember Navarro. And I've also invited Wydell Holmes, who does a lot of work on wastewater. So we thought we would go through a few slides, and I know you're already running a little late with your agenda. We created a PowerPoint, but we're just going to hit on the highlights of it and then open it up for any questions that you may have. So I think, Tim, will you be pulling up the PowerPoint, or would you like us to?
Oh, I thought you guys would, but I can try.
We can.
I'm actually having a little bit of challenge with that, so my apologies, Rosa.
No worries. So maybe perhaps I can give you a quick highlights of where we are while we're pulling up the PowerPoint, whether it's Tim or Wydell that's able to do that. What we're hoping to do is just give you, as you know, and for the audience sake in the community, we have started the wastewater work in 2018. That was the innovation grant that the mayor and council identified as some seed money to start exploring what wastewater epidemiology could do in Tempe. Thank you, Wydell. So as part of that, we're going to share just brief past where we are now, but most importantly, where we're heading with wastewater epidemiology in Tempe. In the next slide. So we actually created a mission, high level, as you know, strategic planning. So we always start with the end in mind of looking at where do we want to go with this type of science. And as you can see, it's to advance community health. It's all about public health and serving as a national model, since this is emerging science and we've adopted and are using in our city to help make decisions operationally. The city of Tempe utilizes sewer data derived from wastewater epidemiology to inform city decisions, strategic policy, and operational strategy. So really being action focused. Next slide. So one of the first things we understand about community health and what we call biointel system, and we have coined that in Tempe, and it seems a little strange of a word to come out of a strategic management diversity office, but we equate it to, and helping the public understand is, as the police department gets intelligence information on keeping our communities safe, we also know there's biological information in our sewer that helps give intellectual information to our city decision makers in making sure that our public is safe. So same path. So we call that biointel system. In case someone out there wants to coin it, we have coined it first in Tempe, just making sure. Science-based data to inform. And that's really when we started this work. It's basically for the community's sake. They flush, we go through the sewer, the wastewater system, and Dr. Rolf Halden looks at that those samples that our team in the water department division sample for us, transports it to ASU. But most importantly, the slide on the right, a data utility for outcomes, is the most important. It's always about the outcomes for our public. It is their wastewater. It's about really, if we're spending this much time and energy and money sampling, how does it help you as council members and our city decision makers make better decisions using the data? So collecting and analyzing the wastewater for the city's decision-making process, it helps to inform strategies that then create greater outcomes as far as community and public health for our businesses and our residents. Next slide. Real quickly, the past, as I mentioned, it started with opioid and a true partnership with our fire medical rescue team, which is also on the line, looking at opioid. And we know that Councilmember Navarro started the wastewater committee work back in 2017, even earlier than that. So we started looking at the opioid as the first kind of intelligence and kind of testing for us in Tempe. Fast forward in 2020, we had started that in 2018. So we had created the cadence between ASU and the city of Tempe. Fast forward, the pandemic hits. We see the opportunity to test for wastewater for COVID-19. Dr. Rolf Halden's team was able to do that. And then we brought along the town of Guadalupe along with us, and we sample for that town through our wastewater. We've had a lot of city and federal inquiries about Tempe's work. We were the first city to have this very robust sampling in our city. Public health campaign started, which is the most important for all of you to know, which was Area 6, in overlaying the COVID-19 testing. And what it shows really when you overlay that with the zip code data is the specific nucleus of the areas in those neighborhoods that are probably hot spots for us to focus on. So what that means for our city is we were able to deploy and use the precious resources, as our fire chief will share with you. PPE was a rare thing during that time, if we think about where we were a year ago today. So everyone was worried about masks and the supplies our fire medical rescue team needed, and how do they use those resources. So pinpointing that was essential. We developed a very strong relationship with the CDC. They have since then stood up a division in the CDC on sewer surveillance. So actually they didn't have the sewer surveillance wing, a division. They have now recently done that. The National Institute of Health Funding Award, we're looking at different funding sources. And when you look at the present right now, and this is one of the things I wanted to share with you, because what we've heard from you and from our community is how do we, when we look at our sample areas, and we'll show you a map in just a second, how do we break down area 1 to smaller areas? It's a very large geographic area. And I have to thank Tara Ford and the water team because they have tried their best in looking at our sewer sewer lines to see what is the best path for testing. Other cities, you should know, test at the wastewater plant. When you think about that, that is all the water coming into one basin, and then they test it. What we're doing, and this is what the CDC is very interested in, and our neighbors should be interested in, is we're able to pinpoint it directly in the geographic areas of our city. And with that, I'm going to give Wydell here an opportunity to share with you a little bit about the slide you see before you.
So like Rosa said, we had a lot of lessons learned, even with our innovation with opioids. And we pivoted quickly in March of 2020 to start testing for COVID-19. And after about a month of proof of concept, we were able to start getting signals from the wastewater. And these signals are important because they're an early warning system for us as a community to utilize this community and neighborhood level data to try to get ahead of pandemics of things like COVID-19. And we were able to show that while the city was closed during the summer, meaning restaurants, schools, things like that, we were showing a very weak signal in the wastewater. When we started to change our behavior and our operations, both personally and in our community, we could see the signal start to reappear in the wastewater. And what we try to do is we looked at the trend of the signal. Not necessarily the strength, although we do measure the genome copies per liter. We're really trying to look at its presence overall in specific areas. Like Rosa said earlier, we were able to secure really targeted outreach and a public health campaign for testing at Fu School in a neighborhood that was seeing a local increase in the water signal, as well as the saliva-based testing that we did on Testing Tuesdays for about 3 months at the Cahill Center. So this was really, what's important about the data is, you know, the science is very exciting to researchers, but for us as public administrators, the decision-making ability and how it informs us for use of limited resources is really the utility, and that's kind of the secret sauce in regards to wastewater analytics in our city. Rosa, you want to tell about the future and where we're heading based on what we've learned?
Sure, absolutely. So what you have before you in the interest of time is the existing sampling basins that we have. And we have currently 8, and that does include the town of Guadalupe. And we have spoken with Mayor Molina and her council, and they're very interested in continuing this work. And for all of you to know, this was pivotal for Guadalupe. They were having a really tough time trying to explain to their community early on that this pandemic was something real. They were still having a lot of families congregate, and so they believed the science really was pivotal for them in the narrative and identifying the promotoras, which basically the outreach they did in the town of Guadalupe based on that. So what you see is the 8 sampling basins, and then what proposed for the CIP, and I know it says CIP $250,000, and that is a placeholder. I've been told, and Ken Jones asked me to make sure to let you all know, because we know that this is a priority for the council. What you see is proposed 11 basins, so adding the additional sampling basins to cut down that area 1 that you see in the blue right in the center. So we would be adding the baseline, which is the purple right centrally. It would be adding the Hardy Station, and then we are looking at Daly Park also. And then the water team was amazing, and they were able to identify also cutting down or distilling that south side, the Carver Station. So as you can see, we are adding at the minimum 2, maybe 3, and hopefully it is 4. And that's still in the conversations with our CFO. The expanding biomarkers, as we can see with the COVID numbers, we are looking to the future working with our fire medical team, who have been tremendous in identifying what biomarkers, and what we mean by that is what else could we be testing for that helps gives us information, especially for our fire department. When we think about respiratory and respiratory calls, so looking at, for example, we always use this asthma medication. If we're able to identify what areas of our city have high levels of asthma, then we would work with our arborist to look at perhaps the species of trees that we have in those parks. And especially, as you know, we have started now with our tree canopy goal. So we're still in the early stages. So as we're planting trees, this could be very pivotal. And the CDC is very interested in this utility work of thinking about the operations of a city and how that biointelligence information gives our team, our collective team in the city, information of how we deploy services. So that's just one example of the list of biomarkers that we have identified as the internal team, the citywide team, along with Dr. Rolf Halden from ASU. We are also thinking about the cost of these things. So looking at, with CDC, they have asked us to apply for a grant that now, since they created a division of sewer surveillance, they have also created a funding source. They are looking at $19 billion that they are deploying through different states, through the Department of Health. So we've had a meeting with Department of Health, and since we have already established process and cadence of this, we're having a meeting with them next week to see if we are able to have some of that funding to help secure what we're doing and alleviate some of the costs for our city. So the next step in the present is really looking at what funding sources, and then also we have been asked to present at the National Association of County and City Health Official Conference in April, and the National Environment Health Association conferences on what City of Tempe as a model city for what they're trying to do nationally. We have also applied for the Bloomberg Global Mayor's Challenge, and we were encouraged to apply, and that is for innovative ideas coming from different cities. And then I think we only have one more slide. So that is not an eye test, as I always say. That gives you an idea of the conversations we have been having internally from our citywide wastewater work, of looking at the biomarkers and really starting with our community's health in mind, from hormone levels and like I said, asthma and any type of other ailments that might be early indicator. I should also share with you that our meeting with the Department of Health Services, and I was sharing this with our fire chief, one of the amazing things they said was, with the pandemic, hopefully the numbers are coming down, everything with the vaccines, things are changing. But they said that the most valuable indicator right now would be probably sewer surveillance, because people are not getting tested, they're getting the vaccine. So if there's a variant or a resurgence of any type, it's going to be that early warning signal that we will see in our sewer surveillance. So it's interesting. We thought that this was coming to an end, and they said, no, if anything, now it's the surveillance is critical. So future, as I mentioned, sustainable funding, expanding biomarkers, and work with our fire department, our fire medical rescue, and then CDC National Wastewater Surveillance System, working with them, and a lot of different acronyms. But in short is, we're doing the work, we continue to move forward, and we're looking for more financial partners and making sure that this is replicated in other cities, and that's what they're looking at. So with that, Madam Chair, I'll turn it to you.
Thank you, Rosa. The presentation was incredible, and every time I see a presentation on the dashboard, I learn more, and I'm fascinated with what you have been able to do and working with ASU. One of the things that I really liked was in a discussion about taking the COVID-19 wastewater information and overlaying it with our equity map, and what you were able to come up with. And what area was that?
That was Area 6, Councilmember Garland. Yes. So what we did, what Wydell was sharing with you, was the utility of it. So looking at the most vulnerable, and I know our fire chief's on the line, but quickly, we knew that's a 7-day lead indicator of what's coming in your city. So we knew that the concentration, and looking at the zip code, was that area 6 around Laird School. There's 200 businesses, 5,100 residents in that area, which is adjacent east of ASU. So we went to work in identifying testing at Laird School, and then expanded it to testing Tuesdays at Cahill Center. And thanks to, I have to say, the fire medical, they built from pipes from Home Depot, the protection in between the saliva-based testing for every participant to be safe. So when I explain this to people, they think, oh, okay, well, you got free tests from ASU. Yes, that was monumental, and we thank everyone who did that. But also, you need to know that there are people going to Home Depot trying to find the most financially sustainable way to build the partitions in order to provide this type of work, a service to our community every Tuesday for about 2.5 months, 3 months.
I did go down to the Cahill Center. I did see the structure that was built. I didn't know who put that together. Now I know. Very good, fireman. I love it. And I also really like the idea that you're talking about what this wastewater research looks like in the future. And I like the idea of, tree allergies, or looking at if there's allergies in that area because of trees or anything. It's thinking outside the box on different ways to be able to use this wastewater program that I think is wonderful. So thank you. Councilmember Navarro, do you have any questions?
Thanks, Madam Chair. Yeah, no, Rosa, this is great. Obviously, was even great when we were back in New York when we were doing our presentation on this on the opioid side. But the fact that we're able to turn this around to track our COVID through the wastewater is just tremendous. So I think that obviously, I think we can take this. We want to take this to the council. We want to get support from the council on this. We do want to make sure that funding, if this is a time to ask for funding, this is the time for ask for funding, especially if we're getting COVID money. This is highly related to COVID money. We should be able to get this funded. I do like the fact that we're looking at grant funding from the CDC. That's going to be tremendous for us if we can expand it even further. So I would say, if we have the possibility to grab more money, are you ready to work with more money to expand it to do other needs? Because I think, well, obviously, I know that we are going to be the model for other cities to follow. And I just want to make sure that we're starting to think really ahead of what else do we need to do? What else do we need to expand on, and try to make sure that we're doing it very proactively and proactive steps down the road. The other thing is, we talked about the schools. How are we with the schools? Where did we get on that? Are they for this? Are they still kind of up in the air?
So I'll answer the first question. Terry P. Cars, Municipal Utilities, and Tara Ford, Jeremy. I can give you a whole list of names from municipal utilities and water who have been lockstep with us on this work. And I can't say enough, because everyone, the capacity that they have given us in this last year, these dashboards look really pretty, but there's a lot of people going into manholes and sampling and making sure that this happens on the weekends and things like that. And the budget support that we have received for this past year for this type of work. The capacity, we do not do anything without checking with Tara Ford and her team to make sure that we are not over-promising and under-delivering. Right. So to your point, everything has been lockstep. We will continue those conversations as far as expanding. They have been at the table regarding biomarkers and what's next. So we will continue to work with them, Councilmember Navarro. And thank you for that question, because as team members, we need to make sure that our team is ready to go and that they're safe, right? And doing that type of work, because some of these sampling areas have been a little tricky sometimes. The second question regarding the school district, we have been in conversations with them, and it's not there yet for them. They wanted to do COVID testing, and we were going to help stand that up and build the infrastructure there. Once again, our water team was willing to do that at Tempe High and Corona. And the truth is, I think they were just so much going on, so much fast pace, and trying to figure out how do they reopen. And they wanted to focus just on COVID. And for us, sustainably, it didn't make sense to pay that much money just to do the COVID testing, especially with vaccines coming on board. So financially, we're thinking, being good stewards of money, we needed to think about once the school is ready, they're reopened, right? We'll continue the conversation with them about perhaps looking at other biomarkers when they're ready and able to do that. So we will keep working at it, Councilman.
Yeah, it's curious to me if and I know some of the fears too is just the privacy stuff and parents and concerns of that nature. I'm curious if the school were to do surveys per school, I guess. Hey, if this was a test school and they could test and they could utilize wastewater as to find out if COVID is back at our school, not back at our school, how we're doing. I would love to see a survey like that, just kind of like get a gauge of what's the interest. Would you support something like this? Why would you not support something like a very simple survey? I think would be very, very key and valuable just to kind of get a lay of the landscape. Because I know this is, it can be touchy with, changing the dynamics, not just tracking COVID, but tracking other things to where that might give people pause a little bit. But I think if we understand the pause or understand the fears, maybe we can figure out a way to address that. So I just mentioned that, just speaking out loud, as a possibility of a thought, not even for the schools, maybe for us too, as we go down this road even further. But everything that we do on this thing, I just highly support. I mean, you guys are doing a great job, really kind of shepherding this thing. I know that Fire and PD has been supportive of this and helping us out tremendously. So let's just try to get this thing moving for sure. And that, Dorian, I think that's kind of what we need to do, is really kind of make sure that we're getting this thing supported, we're getting council behind it. There's so much more, in my opinion, that we can start to translate on this thing to make real change happen. So I think that us laying the ground floor and trying to get this thing pushed forward is going to be strategic for us going down the road.
All right, we'll do it. I'm
Thank
with you.
Great suggestion on the school survey.
Absolutely.
Definitely follow up on that. Thank
Yeah.
you.
All right, thank you again, Rosa, and Wydell, thank you so much. And if we don't have
You're
any other
welcome.
questions, then Joel will move on to the next item. All right, thank you so much. Our next item is a presentation on age-friendly designation, and it's with Maria Raymond from the Human Services Manager, and Candace Hewitt, Senior Social Services Coordinator. So if you are ready to present.
Council members, this is Paul Bentley, if I may.
Hi, Paul.
Hi, if it's possible, could we please flip the agenda a little bit and begin with the social determinants of health and then move into the age-friendly? Just the order makes a little bit more sense.
Absolutely, that's fine with me.
Apologize for the late notice.
No problem. Okay, so we'll do a presentation on social detriments of health and mental health and a mental health roadmap. And we'll do that with Paul Bentley, our Deputy Human Services Director, Sean Wagner, Deputy Community Services Director, and Aaron Peterson, Strategic Management Analyst. All yours, Paul.
Thank you. We're going to work on the echo. Okay, thank you. I'm going to share our screen. We're in a share screen for just one moment. I believe we've corrected. No. That should have done it. There we go. Okay, so I am sharing my screen. And we'll begin. So again, my name is Paul Bentley, Deputy Human Services Director, and with me this afternoon is Aaron Peterson, Strategic Management Analyst from the Office of Strategic Management, the Department of Strategic Management and Diversity, and Sean Wagner, our Deputy Community Services Director. And thank you for inviting us to participate in this presentation, and we look forward to your questions and comments following our update. So the purpose of our conversation today is to discuss the concept of the social determinants of health and how this work can help inform decision-making here in Tempe. The specific topics that we're going to cover this afternoon are first, defining what the social determinants of health are, to create a common language, and then to explore Tempe's approach specific to the social determinants of health by making what is really a national dialogue on these determinants very local and purposeful for the city of Tempe. We're then going to discuss the alignment of these determinants with established council priorities and performance measures and possible future measures. And then finally, we want to conclude with a conversation about how this work will help us inform from staff our work, but also help with the possibility of informing the community as well as this committee specifically in future decision making. To put this in context, many of you may have been present when we had a similar conversation when it was specific to housing, and that staff and elected officials went through a process of creating a common language, which ended up in us having a very clear understanding, or I believe a clear understanding, when we speak about the different levels of housing, whether it's affordable housing, whether it is workforce housing and or market rate housing. So today's conversation is intended to set that same foundation specifically to the social determinants of health, is how we're putting that together. And then as we present this information today, we need to keep in mind that we must also acknowledge that the universe of factors included in the social determinants are larger than what Tempe can affect alone. And what we mean by that is this is a collaboration with our partners through creative approaches that will be necessary to affect change across all the determinants. So what are these? What are the social determinants of health? Very simply put, the social determinants of health are the economic and social conditions that influence differences in health status. This includes the health promoting factors found in one's living and working conditions such as the distribution of income, wealth, influence, and power, some of which are shared by public policies. And so to get into this a little more specific, let's talk about the World Health Organization. So the World Health Organization helped facilitate an understanding of these determinants in the early 2000s. In 2008, WHO published a report which aimed to understand from a social justice perspective how healthy inequity could be remedied and what actions could combat factors that exacerbate injustices. And what they found and they determined is that the unequal distribution of health damaging experiences is not in any sense a natural phenomenon, but is the result of a toxic combination of poor social policies, unfair economic arrangements. And overall, what that means is that the work that we are doing can make a difference because there are structural things in place that contribute to negative health within the community. Further, the United States Centers for Disease Control look to apply the social determinants to the American population. And they define the social determinants of health as life-enhancing resources such as food supply, housing, economic and social relationships, transportation, education, healthcare, including mental health supports, whose distribution across populations effectively determines length and quality of life. And in simple terms is that as those components are in effect, or those components are in place for community members, that over the length of time, over averages, looking at averages, that those particular concepts influence one's length of life and their quality of life. Meaning that based on where you're living, statistically, you are going to probably live longer than someone else. Statistically, based on where you are living, based on the availability of these factors. So additional examples include access to food, insurance coverage, income, housing, and transportation all impact, again, length and quality of life. So simply stated, a nation's wealth, so we're talking at the national level, a nation's wealth is a strong indicator of the health of its population, okay? But within a nation, it's an individual social economic position that is the powerful predictor of health for that individual. And so this is that conversation where the law of averages, or looking at averages, the nation might be seen as a very healthy entity. But when you look specifically or more in depth at the data, that you find specific populations don't seem to have that same benefit as a whole. So understanding this, human services and community services have worked to identify the social determinants of health that are measurable for Tempe. In other words, the determinants is a way to evaluate the resilience of our community and plan for how to improve areas of imbalance can be addressed. And that through this work, we can build a resilient community across the board. Okay, so a lot of concepts within a very little bit amount of time, but this is a beginning conversation. So on this slide, what you're seeing is one example of the social determinants of health. And so the question is, why is this one example? Are there many? And the answer is there are, which is leading to the next point. There is not currently one agreed upon framework for cities to simply implement and begin analyzing community health. However, the social determinants are typically presented in 5 or 6 categories, each comprised of various factors, like the one that you see here. And specifically, we're talking about economic stability, neighborhood and physical environment, education, food, community and social context, and I need to move my speaker card, in the healthcare system as examples of these concepts that are determined to be the determinants of health. And so in that, while there is general agreement about the nature of factors, the breadth and means of measurement vary. So what you're seeing here on the screen is an example from the Kaiser Family Foundation. You can Google it, you can find it. It provides a good working visual of the types of categories and factors that research has shown can be reliably used to predict future health outcomes. And those are listed here in the boxes above. So again, looking at this specific example, focusing on education, what this is saying is that if a community focuses on enhancing the educational experience within the community, the health of that community will benefit. The same with food, the same with the healthcare system, is that if you provide specific responses in those categories, your community should reap a more healthy community overall, is what this is intended to do. The complexity occurs in how do you go about measuring that? And that's where our partnership with the Strategic Management and Diversity Office and the performance measures approached by the City Council are so helpful for us, because it points to the fact of how do we get to real data within the community of Tempe to help us measure how we're doing in these categories. And so that's our intent. That's the work that we have been going through, and our intention of continuing to move forward so that we can operationalize this in a way that makes sense for Tempe. So as an example, the food category seems fairly straightforward, and it can be interpreted to mean that neighborhoods across our city should have equal access to grocery stores, which will result in access to healthy options. What is not as obvious is that communities of color may not be able to afford the healthy options and will therefore rely on food boxes that are historically carbohydrate filled with limited fresh produce and lean protein options. The result is a higher incidence of obesity and diabetes within these communities. Sean?
Thank you, Paul. So understanding that there are multiple approaches to the social determinants of health, human services and community services have been exploring different ways to develop a reliable framework for Tempe. So initially, each department were independently pursuing different efforts. Community services was looking at community health and wellness, and human services was focusing more in on the mental health and wellness. But upon discovering a significant overlap in our research, we decided to consolidate our efforts and have been working together as a task force and a group now to develop that framework for Tempe more holistically and something that we can measure annually. Since 2015, the Human Services Department, they've been working towards a greater understanding of trauma and how it affects our community. By implementing programming that mitigates the effects of trauma, we can ensure that Tempe is building a more resilient community. Prioritizing programs for children, for example, by addressing the SDH, the social determinants of health, and developing appropriate services is definitely an investment in the future of our city and its residents. Another example here is the Live Well incubator application that led to a new opportunity with Arizona Healthy Communities and Vitalist Health to develop a reliable model for Tempe to implement. The hope here is that this can then be replicated in other Arizona communities, if not beyond Arizona. So the value of Tempe developing a model is both for policymakers and staff will have better insight into scoring each of these factors when considering policy and programming decisions. This model will also provide a means of measuring the impact of policy decisions over time, and we can then adjust if the desired outcomes, if they're not realized. So there's still some flexibility built in this system, and one that allows us to address the current needs of our community while keeping an eye on our future. At this time, Aaron's going to step in and take over talking about our City Council strategic priorities and the relationship with social determinants of health.
Thank you, Sean. So one of the things that we look at when we're trying to set goals and priorities is, can that goal be measured? And one of the great benefits of looking at an international model like the WHO organization is that they do a lot of the heavy lifting of figuring out what factors really go into creating a healthy community, whether that's education, healthcare, and neighborhoods. So point number one would be to focus on the fact that there's such great research around that, and it gives us that visionary level that we can then try to create some specific goals around. Then point number two is, because of this great research, we also don't have gaps in between that. These overlap just enough that we're covering all of the important areas, but it's very holistic, and we avoid having gaps in the services that our community needs and the programs that they need in order to have that healthy environment. And then the third benefit is that it establishes a common language. So when we're setting goals, we want to be able to compare ourselves to other organizations, other communities, other cities, when appropriate, to see how we're doing. What is A+ performance really going to look like? And when you have common language, that helps a tremendous amount in being able to compare to what organizations are doing. And then we can then customize what we're focusing on. What goals are we setting? What works for our community? What's particularly helpful? What do we need to focus on? Next slide, please. So if we then look at how that fits in the approach that we're taking here at the City of Tempe, it aligns quite well. As you'll see, our performance measures are focusing on the strategic priorities of safe and secure communities, strong community connections, and so forth, which again are at that very visionary level. And then it's our responsibility at the staff level to establish goals that are measurable, asking ourselves, where are we on this particular need? Where is it that we want to be? And then how are we going to get there? What strategies would we create? What tactics, what operations, and making sure that they're measurable. So again, that points to us filling all of the gaps in transportation goals, housing goals, the quality of parks and facilities, all of those things that are going to feed towards this quality of a healthy community. And then again, using that common language so that when we are trying to figure out what does A+ performance look like, we know who we're comparing to and what we need to achieve in order to get there. And with that, I'll turn it back over to Paul.
So the social determinants of health in their current state are a global tool that is being used to help inform government and other entities on how to use the resources best to help assist in promoting the healthy community. And the work that we are doing here, presenting here, is intended to bring that very local to the City of Tempe as discussed. And we have a very strong belief that it's the right thing to do, that it makes sense, and that with our work with Vitalist, who's coming in to assist us with their expertise, that we will be able to come up with specific data measures, specific data sources to help inform decision making. And from that, some examples include helping inform policy as defined by our elected officials, to enhance development deals or requirements as they're being conducted through community development or economic development, to utilize it as a form of business attraction to others looking for a community to help support their employees and their own business themselves. We look at this as a means to promote the equitable distribution of amenities within our city through city investment, and to improve overall strategic partnerships. Again, as mentioned before, this is not intended to be a City of Tempe staff only affair. This is something that is much bigger than that, in which we are a significant partner and contributor, but we will be utilizing those within the community to help assist and learn from and promote this as we move forward. Specifically, the task force that was mentioned earlier, the current task force is made up of multiple departments. We have membership from Strategic Management and Diversity, Human Services, Community Services, Tempe Community Council. We also have membership from a faith-based organization as a part of this in order to help us keep the group small enough to be operational and active, but inclusive enough so that we have multiple viewpoints and ideas to work with Vitalist to make this work across all of those areas, whether it's transportation, whether it's health, whether it's mental health, whether it's education, whatever that may be, that we have the ability to look at each of those areas in a way that makes sense. So again, please keep in mind that this has been a very high level overview. It has in some way oversimplified the scope and the impact of social determinants of health, but for today, again, the intention was to start establishing a common language. Significant work is required in the next steps. We have a plan to do that. In addition to that, it's promoting knowledge for the city as it progresses towards supporting human services and community safety. This specific committee in the way to help promote a resilient community. With that, we are available to answer any questions that you may have, and I'll attempt to put my camera on. I apologize.
Thank you. It was a great presentation, so thank you, Paul and Sean and Aaron, for that information. It is kind of high level. I've not heard this discussion before, but I see that what it looks like to me is that we are looking to really build and focus on the quality of life in the city of Tempe, and really looking deep into the health outcomes and data that will make living in the city of Tempe a better place to be. I like how you were talking about the equitable distribution of health and wellness. We want that. That's really important in the community. So when you're talking about the common language, you're talking about measurements, right? Is that common language a measurement so that we understand how we can look at that and take this and relate this to not just the city of Tempe, but others if we need to discuss this?
That is a component of it, absolutely. The other piece is that we're really kind of from a top down looking at, do we have it right for Tempe by focusing on those main determinants themselves? Does focusing on economic stability make sense? Does looking at food make sense? The answer probably is going to be yes, but we're going to go ahead and have that question, which is, do those main 5 determinants still make sense for Tempe? But then also from that common language, moving into, again, making it useful for you as the elected officials, for staff, for the community, as to, if we're going to talk about food, what do we mean by food? Is it hunger? Is it access to food? Is it the type of food that's available? And so defining those things so that when we're at the table and we're all talking about, all right, what are some specific initiatives we can do to help move this food determinant forward, that we're on a common language and understanding, rather than talking different things and coming up with results that aren't going to be in alignment. So it's really, again, the top layer of what are those determinants that we want to, how we want to name them for Tempe. And then, as you mentioned, Councilmember Garland, it's what are the specific indicators of data that we're going to use? Is it going to be the number of grocery stores, or is it going to be the type? I mean, that's where the common language comes into place.
Okay, that makes sense. And your food analogy worked really well for me. But I was thinking specifically when you had mentioned about, fresh fruit, fresh vegetable, is that commonly set across the city or for us to be able to use? But I appreciate that. That is going to be really helpful. So when are you looking at that you're going to have this program set and ready to go to start gathering all that data?
Well, we have, Vitalist has agreed to I'll be brief, but I think it's important. We put in an application, the task force put an application in last fall for the Live Well Arizona Incubator to help get coaching and assist us in creating this common language and method. We weren't selected. There were five other projects that they felt that were more in alignment with what they needed for that specific application process. But once they completed that, they came right back to us and said, we're not going to put you in this process, but what you're doing is that important to us that we want to help you anyway. And so April 15th is our first meeting with, we've already met with them before, but April 15th is our first meeting with the task force and Vitalist. And we will continue to provide updates as we move forward. I don't have a specific date. I just know it's important to all of us to get it done pretty quick.
I appreciate that. Thank you so much. Councilmember Navarro?
Yeah, thanks, Madam Chair. This has been outstanding, guys. I have to tell you, I'm really intrigued with this. I was just looking at blue zones, and kind of reading up on all those things and why people those areas live so long. And you kind of touch on every little thing I've been reading, various things of food, of community, of exercise, of faith-based and things like that, which all those things are so strategically together or put together very well. So I'm really intrigued by how can we advance this. There's almost like a marketing component to this as a city, trying to get people to remember the types of, hey, these are the restaurants we provide within the city. These are inviting these types of restaurants that provide healthier choice, inviting more grocery stores, just like you said, that provide healthier food. I think that's like a marketing strategy. We have connectivity between parks, our exercise, pre-K. That's another, advantage that we're doing as a city. I think this is a great incubator place for this project to work. I'm looking at Linda Loma in California, who's one of those blue zones over there, and they're a vegetarian community, very tight knit. It's almost like, what are the takeaways from that? Why is it like that? And I know that, across the board, it's income. I kind of look at things as income and how the incomes affect each other, not your race or any other factors, incomes, education and things like that, how those things really play a part in trying to grab everybody. I know that there probably is a first start, but does that first start help lower incomes, lower education, things like that? I mean, this is really intriguing how we can go forward with this. So one thing I was wondering too, I know you guys are collecting data, but what about a survey? What about a survey, and maybe you did this, of our residents in terms of how do they view our community? How would they, I don't even know the questions, but how can we make questions of a survey to kind of get a gauge of the pulse of the community to get into this mode, or to see how they view our community as healthy or not healthy, things like that. Much more to think about, but I think a survey of that would be a great gauge to kind of get the pulse of, can this community go forward with something like this? I think we can support this, and I think it's one of those things where, yes, you need a financial backing, but at the same time, you just need organic movement too. So
yes,
yeah, I love it. Thank you, guys.
Thanks, Council. Thank you both, council members.
Yeah, so one of the things that is, what can we do? What can Councilmember Navarro and I do, and this committee do to help you move this along? Is there anything that you need from us?
I think from my perspective is just assisting in the conversation right now, which is an understanding that the social determinants of health are intended to be a foundation to help. I mean, there are current initiatives that we have coming forward that are directly tied to this, and one's going to be spoken about in just a minute with Age Friendly from Marie and her team. The Park Safety Initiative, the Shelter Initiative, the Mental Health Response Team Initiative, stuff coming out of Community Services in Sean's area. The intention is to hone it in a way that you as our elected body can have comfort that when we're bringing these things forward, that we are tying them not only to the council priorities, which we will, but also have a foundation of community health that helps promote it even further. And so really, to answer your question as brief as I can, It's more of helping us just with using the language and asking us questions to help refine it if we need to, and we will. But that the intention is for this to be it's intended to be a model so that when we're thinking of new initiatives and concepts to promote the mental health, we can tie them right in and flow right up into the council priorities.
That makes a lot of sense. That's perfect. All right. Well, I appreciate it. Thank you so much, Aaron, Paul, and Sean. Thank you so much for being here and giving us this presentation. And I cannot wait for you to come back and give us some more information. And again, reach out to us at all if there's something else that we can help you to do to move this along.
Thank you so much.
All right. So we have one more presentation, so we're going to try to get through that really quickly. We have 8 minutes. Paul, do you think that that's possible for us to do still?
I'm sure Marie can make it happen.
All right, Marie, you are up with your presentation on age-friendly designations. So thank you.
I am sharing my screen for you, Marie, in just one moment.
Thank you. Well, good afternoon, council members. Marie Raymond, I'm a Human Services Manager, and with me is Candace Hewitt, a Senior Social Services Coordinator. And so you just heard a presentation noting the factors that are considered when looking at the health of the community. So our age-friendly Tempe presentation will serve as an example of how we've been working within the social determinants of health framework and how we've been looking at the community as a whole through our work to achieve the AARP age-friendly community designation. So this work has been formalized under the Strategic Priority Quality of Life as Performance Measure 3.30, which is to achieve the age-friendly community designation for livability from AARP. In achieving this designation, we look at how Tempe can be a livable community for residents as they age, knowing that making our community more livable for older adults improves the quality of life for everyone. So I'm going to turn it over to Candace Hewitt, who will provide more details on what it means to be an age-friendly community.
Thank you, Marie, for the introduction and the connection of the social determinants of health to the work we're doing to achieve age-friendly community designation. The American Association of Retired Persons, AARP, defines a livable community as safe and secure with affordable and appropriate housing and transportation options that offer supportive community features and services. Once in place, those resources enhance personal independence, allow residents to age in place, and foster their engagement in the community's civic, economic, and social life. It's about making a commitment to create a livable community. Next slide, please. To this, we're looking at 8 domains of livability that have an impact on the well-being of older adults. The domains framework helps prioritize a community's work to become more livable for older residents, as well as the community as a whole. The domains include the availability of outdoor spaces, buildings, and recreational facilities that are safe and accessible, safe and affordable modes of private and public transportation, a range of age-friendly housing options and home modification programs for aging in place, access to leisure and cultural activities, including opportunities for older residents to socialize and engage with their peers as well as with younger people. Programs, programs that foster respect and social inclusion, that promote ethnic and cultural diversity, as well as multi-generational interaction and dialogue. Paid work and volunteer activities for older residents and opportunities to engage in the formulation of policies relevant to their lives. Access to communications technology and other resources so older residents can connect with their community, friends, and family, and access to home-based care services, health clinics, and community programs that promote wellness and active aging. Next slide. The great news is that the City of Tempe is a livable community, and we're compiling measurable results in all 8 domains of livability already. With the help of Tempe's strategic management, we've identified many in-progress performance measures that are making Tempe more livable. Through collaboration within the city and key stakeholders, we'll continue to identify measures that align and look for possible gaps that need attention. Next slide. So where are we now? To date, we've formed an action team comprised of people from both the volunteer and local business sectors, ASU members from colleges with specific interests in older adult populations, philanthropic and nonprofit organizations, and city staff who are working with residents already that are 50 or older, or they're leading projects with in-progress strategic measures that impact older adults and residents that are 50 or older, both longstanding and new residents. The action team has met 3 times to share data collected from key stakeholders regarding quality of life for older adults living and working in Tempe. The team has collaborated with Tempe Community Council, TCC, to help inform the community needs assessment that will serve as one of the tools that informs the age-friendly action plan. Up next, we're going to launch a web presence to introduce the age-friendly initiative and keep residents and employees who work in Tempe informed. We want to collaborate with TCC to disseminate the community needs assessment through the age-friendly action team. Also, conduct listening tours with older adults, caregivers, and Tempe residents. We will utilize findings to draft and then submit an age-friendly action plan for approval. And then we're going to begin the work towards the goals outlined in the plan. Well, thank you for your interest in age-friendly Tempe, and I'm going to turn it back over to Marie for any additional thoughts. Marie?
So as you can see, we're currently moving forward with work towards improving the health of the community and addressing the social determinants of health. And Candace described the ways that achieving an age-friendly community designation ultimately makes the community more livable and improves the quality of life for everyone. So we acknowledge that this work has been ongoing, and we're excited to continue to align our programs, policies, and procedures in support of a healthy, livable community for all Tempe residents. And we're happy to answer any questions you may have.
Thank you, Marie and Candace, for that presentation. I have to tell you that were a number of people when I was campaigning that were senior neighbors that said that one of the most important things to them was aging in place and being able to stay in Tempe and stay in their home. So I appreciate this this information that you've given us today. I remember one of the things that they thought was really important is they just wanted more outdoor activities and gathering places for people of their age. And so I just wanted to mention, when you were saying you're doing outreach to a couple different organizations, TCC and TCAA, I was wondering if you were also going to look at doing outreach to some of our boards and commissions. Specifically, I was thinking of the Neighborhood Advisory Commission, who might be able to help you gather information or offer inputs also. So I'm just going to kind of throw that out there. But it was a great presentation. Thank you. Councilmember Navarro?
No, once again, I really great tie-in. I think this is outstanding. Like I said from the first one, a lot of things intrigue me on this stuff. I mean, the activation of just our local parks. You talk about aging in place and having the opportunities to utilize our parks. We don't even utilize our parks to the maximum that we can. So that's programming. That's bringing things in at a certain time and having those activities out there. And organically, these things start to translate into things that are needs in our community. So I think there's some great ideas to go forward. So I appreciate this.
Thank you very much.
Well, thank you so much for your presentation. I appreciate that. And we will go ahead and conclude that part of our council meeting. So Joel, the only thing we have left is to consider what we are interested in doing at our next council meeting. So we're going to move on to agenda item 4B. We had some notes of information on here. We had talked about doing a presentation for Hometown for All initiative, a presentation on the city's response to the opioid epidemic. A presentation on examining the relationship between cannabis dispensaries and a reduction in opioid deaths, and an update from Tempe PD on the Narcan program after 1 year of it being in process. Joel, did you have anything else you want to add?
No, that'll be a good agenda. As we can see from this one, they'll probably take our time up. So let's keep it as that.
Okay, sounds great to me. Tim, do you have any other suggestions or recommendations for anything to add, or does that look good?
That looks good to me, Councilmember.
Okay, great. Thank you so much. We'll move on to 4C. Any new announcements? Councilman Navarro, anything?
Nope.
Nope. All right. We are good. We get through that last part in just less than a minute. All right. Well, our next meeting is going to be Friday, April 23rd at noon. I want to thank everybody again for joining us. And if you have any questions or would like some more information, or if you would like to see the slides that were presented in this meeting, you can go to tempe.gov/HSCS. And at the very bottom of the page, you can click on this meeting date today and all of the slides will come up so you can look at them at your leisure. So if that's all we have, then we will adjourn now at 1:31. Thank you, everybody.
Thank you.
Thank you.
Thank you.